Hello and welcome. Today, we're diving into a common, yet often misunderstood, condition affecting the gallbladder polyps. We'll explore what they are, how they form, how they're diagnosed, and what treatment options are available. So, what causes these little growths in our gallbladder? While the exact cause isn't fully understood, several factors can contribute. Cholesterol polyps, the most common type, are linked to high cholesterol levels. Other potential causes include chronic inflammation of the gallbladder, a condition known as chronic cholecystitis, and certain genetic predispositions. In rare cases, gallbladder polyps can be a precursor to, or even represent, early gallbladder cancer. However, it's important to remember that most gallbladder polyps are benign. Let's talk pathophysiology. Essentially, gallbladder polyps are abnormal growths that protrude from the inner lining of the gallbladder. These growths can be made up of cholesterol deposits, inflammatory tissue, or less frequently, cancerous cells. The formation of cholesterol polyps is thought to occur when cholesterol crystals deposit on the gallbladder wall and become coated with proteins and other substances. This creates a small, raised bump, or polyp. Inflammatory polyps arise from chronic irritation and inflammation of the gallbladder lining. How common are gallbladder polyps? The prevalence varies, but studies suggest they are found in about 3 to 7% of adults who undergo gallbladder ultrasound. They are more often detected incidentally during imaging for other abdominal issues. They tend to be more common in men than in women, and their prevalence increases with age. Often, gallbladder polyps don't cause any symptoms at all and are discovered incidentally during an abdominal ultrasound or CT scan performed for another reason. However, larger polyps, particularly those larger than 1 centimeter, may cause symptoms similar to gallstones. These symptoms can include right upper quadrant abdominal pain, nausea, vomiting, and indigestion. It's crucial to consult a doctor if you experience these symptoms, even if you think it's just indigestion. Diagnosis typically begins with an abdominal ultrasound. This is a non-invasive imaging technique that uses sound waves to create images of the gallbladder and surrounding organs. If a polyp is detected, further imaging, such as a CT scan or MRI, may be recommended to assess its size, shape, and other characteristics. An endoscopic ultrasound (EUS) can also be used, especially if there is suspicion for malignancy. These advanced imaging techniques help doctors differentiate between benign and potentially cancerous polyps. Gallbladder polyps can be broadly classified into 2 main categories: pseudopolyps and true polyps. Pseudopolyps, also known as cholesterol polyps, are the most common type and are benign. True polyps can be further divided into benign and malignant types. Benign true polyps include adenomous and inflammatory polyps. Malignant polyps are, of course, cancerous. The approach to treatment and management depends largely on the size and characteristics of the polyp, as well as the patient's overall health. Small polyps, typically less than 6 millimeters, are often monitored with regular ultrasound check-ups. Larger polyps, particularly those larger than 1 centimeter, or those that are growing, are usually recommended for surgical removal of the gallbladder, a procedure called cholecystectomy. Cholecystectomy is also typically recommended for any polyp that shows suspicious features on imaging, such as rapid growth or associated gallstones. Laparoscopic cholecystectomy, a minimally invasive surgical technique, is commonly used. Unfortunately, there's no guaranteed way to prevent gallbladder polyps entirely. However, maintaining a healthy lifestyle, including a balanced diet low in cholesterol and saturated fats, and regular exercise, may help reduce the risk of developing cholesterol polyps. Managing underlying conditions like high cholesterol can also be beneficial. The prognosis for patients with gallbladder polyps is generally excellent, especially when polyps are small and detected early. Most polyps are benign and do not pose a significant health risk. Regular monitoring can help detect any changes that might warrant further investigation or treatment. In cases where cholecystectomy is performed, the prognosis is also typically very good. Research is ongoing to improve our understanding of the factors that contribute to the formation of gallbladder polyps and to develop more effective methods for early detection and diagnosis. Some recent studies are exploring the use of advanced imaging techniques and biomarkers to better differentiate between benign and malignant polyps, potentially reducing the need for unnecessary surgeries. Thanks for watching.